Hello, I'm Dr. Tim Friel, the chair for the Department of Medicine and an infectious disease specialist at Lehigh Valley Health Network. Welcome to Lehigh University for the fall 2020 semester. This brief learning experience will provide you with facts about COVID-19 and information you need to know about returning to campus and teaching classes safely. Lehigh University has partnered with Lehigh Valley Health Network, also known as LVHN, to ensure best health practices are in place for faculty and staff. Our partnership includes 5 essential services. First, a dedicated employee health nurse case manager. Second, expedited access to care with suspected exposure or when symptoms are present. Third, access to COVID-19 testing. Fourth, contact tracing and confidential reporting in partnership with local health bureaus. And finally, medical consultative services to support the university's COVID response planning efforts. The partnership with LVHN is focused on occupational health services, while the University Health and Wellness Center will remain focused on student health and safety. LVHN and the Health and Wellness Center are working closely together to ensure consistent practices. The LVHN Return to Work and School Task Force has supported dozens of colleges and universities, regional school districts, and employers with COVID-19 return plans, and has discovered 3 keys to staying as safe as possible. First, safe practices for exposure prevention and workplace hygiene. These include tactics like spacing furniture for social distancing, the use of signage and visual cues for distancing, shielding when appropriate, use of personal protective equipment, and easy access to disinfection products. Second, continuous surveillance for the virus, primarily through daily symptom screening. This is essential to reduce the risk of an outbreak on a campus or other workplace. Finally, rapid access to diagnostic tests and treatment, as well as care coordination for anyone who tests positives, are essential components of our strategy. LVHN's team of coronavirus experts, including physicians specializing in infectious diseases, is working closely with Lehigh University. This team is advising Lehigh on many fronts, from social distancing and the use of personal protective equipment to interpreting national and state guidelines and customizing these processes for Lehigh. Throughout the pandemic, these and other experts will be available to advise as needed. The physician team will include me, Dr. Tim Friel, the chair for the Department of Medicine at Lehigh Valley Health Network, Dr. Carmine Pelosi, the chief of the Division of Occupational Medicine at Lehigh Valley Health Network, Dr. Amy Slenker, the Vice Chair of Quality and Patient Safety for the Department of Medicine and an infectious disease colleague of mine. Being safe on campus begins with a personal responsibility to follow established guidelines for minimizing the spread of COVID-19, including these 5 essential steps. Wear a mask whenever possible, especially during times when you're around others. Stay 6 feet apart to maintain social distancing. Disinfect high-touch surfaces frequently. Screen for symptoms daily. Report potential exposures immediately. The partnership with LVHN includes an employee health nurse case manager to support all of the COVID-19 care needs of the faculty and staff. Her name is Terry Latvis. She will be your point of contact and support from the time you suspect exposure or experience symptoms, and if diagnosed with COVID-19, through full recovery. She is available to guide you in the process and work hand in hand with you, the testing site, your primary care physician, and Lehigh University Human Resources. There are a number of situations where Terry can provide immediate assistance. Here are some examples of when it would be appropriate to contact the nurse care manager. If you have questions about COVID-19, if you feel you might have been exposed to COVID-19, either on campus or elsewhere, but have no symptoms. You might need help registering for MyLVHN to access a video visit. You might need help using MyLVHN to access your test results. If you have questions about your treatment plan while recovering from COVID-19. If you are planning to or have traveled to a CDC or Pennsylvania Department of Health identified COVID-19 surge location. Our employee health nurse case manager is available 7 days a week to answer any questions you might have. You can contact her by phone or by email. Terry's contact information is also available in the information emailed to all Lehigh employees and on the Lehigh University webpage And of course, Human Resources will have our contact information. If you suspect COVID-19, the first step is to immediately isolate yourself at home and seek care. If you experience any of these severe symptoms, go to the nearest hospital emergency department. These symptoms might include shortness of breath, pain or pressure in the chest, confusion, the inability to wake up or stay awake, or the development of bluish lips or facial discoloration. These are potentially concerning symptoms of COVID-19 and warrant immediate evaluation. Through the partnership with LVHN, Lehigh University faculty and staff have access to the region's most efficient means of getting screened, tested, and diagnosed. If your symptoms are mild, as is commonly the case, you can get started from home by completing a COVID pre-screening virtual visit. It's fast and you can access care without potentially exposing others. The 3 ways you can complete a pre-screening assessment include an e-visit, a COVID-19 video screening visit, or you can simply call the nurse information line. These links are available in the information emailed to you and on the Lehigh University webpage. You can also choose to contact your primary care provider first. However, the LVHN screening may be the fastest way for you to be evaluated and get tested if needed. Any results from LVHN will be shared with your primary care physician. After accessing care, please contact the Employee Health Nurse Case Manager as soon as possible. Terry will assist with your care and handle contacting Human Resources for you. As previously mentioned, if you experience severe symptoms, go to the nearest hospital emergency department. For most people, symptoms of COVID-19 are mild, and treatment or interventions will be prescribed based on specific needs. LVHN remote home monitoring is available if needed and prescribed to monitor symptoms. It is critical to remain isolated at home in order to prevent risk of transmission to others. During recovery, the nurse case manager will check in with you frequently. If you have mild or no symptoms, you may be able to work remotely. When someone is tested positive for COVID-19, it's important to identify those with whom he or she has had contact and attempt to stop transmission to others. LVHN will work closely with the local and state health departments to complete contact tracing. All positive COVID-19 patients tested at LVHN are eligible for primary and secondary contact tracing services. These activities will follow CDC guidelines and are documented in the LVHN electronic medical record. Comprehensive data analytic models allow us to track data at the community and individual level. Returning to work after having COVID-19 symptoms or testing positive includes several considerations, including residual symptoms and possible limitations. A not insignificant percentage of individuals infected with COVID-19 will continue to experience residual symptoms after no longer being considered infectious. Please discuss any residual symptoms with your personal health care provider to determine when it is best for you to return to work. If any limitations are needed, you should inform your supervisor and provide a note with these specific limits from your healthcare provider. Your employee health nurse case manager will help ascertain when you are cleared to return to work. We encourage you to stay in close touch with her throughout the entire process. Thank you for taking time to view this presentation. We are working together as a community to keep ourselves and others healthy. As guidelines are updated, the most current information will always be available on the Lehigh University website. And the LVHN Nurse Case Manager will always have the most up-to-date information available for you. By following the program outlined here, we can all look forward to a productive and rewarding year at Lehigh University.